Bisa dimulai, Pak?
Yes.
Bisa?
Bisa.
Ya,
Sesuai dengan rundown, kita menunggu arahan dari Prof. Gufron.
Okay, so it means that we will wait for another 5 minutes.
Harus keluar itu dulu kan kalau rename.
Aku itu benar
sudah ada baca. Ketiganya di atas, ketiga itu akan betul yang ketiga RTP 66 itu RTP 66 di atas atasnya.
Oh ini.
Ya, tiga-tiganya ini.
Oh ya.
Kemudian di IC dari pasar. Bisa.
Ini.
Ya.
Sudah?
DIC. DIC. Bahasa Inggrisnya. Di atas.
DIC.
Bahasa lu sudah benar. DIC.
Sudah? Okay, can we start? Sorry. Yeah. Can we start?
Yes, please.
Yes.
Yes, better we start maybe because I have left a message with Indri anyway, and I know that
Biar bisa buka PPT ya.
is still waiting. He's still with the minister, but he will join later. Is that okay, Pak Mong?
Oke. Tentang Pak Gufron bagaimana, Bu?
He still masih dengan menteri, Pak. Sebentar lagi akan join. Tetapi kalau dengan because otherwise he knows that I have sent him a WhatsApp already.
Ya, kita go on ya.
Yeah.
Okay.
Shall I start?
Di-share soalnya.
Shall I
Yes,
start?
please. Yes, please.
Yes. Okay. Yes.
Maybe, yes, and think maybe if all of us turned our microphones off whilst you're talking, and then in Zoom we can use the hand facility, I think, as well, if you want to come in. I think we can. So you can do, can't see it on this one, but usually you can do that. But I think if we turn our microphones off, then Yanti, you can start.
Okay, can I start?
Yes, please.
Yes. Good afternoon. In Indonesia, this is good afternoon, ladies and gentlemen. I am glad to see you all. Let me introduce myself and my team. My name, Dr.
Randonnya dibaca, Pak.
Saya.
Mbak Yanti dulu. Randonnya dibaca.
Yeah.
Mohon dibacakan randonnya, Pak. Bu Yanti.
Yeah. So the one, as I told you, Pak Hamong, sorry. So shall we open this webinar? So we'll start now. We will end at 2:30 Jakarta time on the dot. So let me begin by introducing our distinguished guest, Prof. Guy Daly from Coventry University, the United Kingdom. He is our Deputy Vice Chancellor atau Wakil Rektor di sini. His special expertise, to be very clear, is about social policy in health. So he is not a medical doctor, but he's an expert in kebijakan kesehatan publik, so that you all understand. So he has very kindly what we call helped review and edit your paper, which is about COVID-19 and pets and pandemic case study of 15. So the rundown of today, so after me, then I will let Prof. Gufron, then as representing the Ministry of Research and Technology, as well as the head of Consortium 19. Then I will leave the floor to all of the authors and the presenter. Then I will give the opportunity for Prof. Guy to ask questions and seek clarification, or ask provide some suggestion as to how the authors can improve their paper and vice versa. For the rest of the audience while listening, if I may suggest, please actually ask at the end after the what we call the discussion between the authors led by Dr. Hamong in Udayana and Prof. Guy Daly and Prof. Gufron. Is that clear, please? I will only translate and summarize as needed and if very needed. Okay, is that clear?
Yes, clear.
Okay, okay. So that's the rundown of today, Pa. So while waiting for Prof. Gufron, actually, I think that, so I am Yanti Amran, so from Coventry University Rep in Jakarta, I will help a bit moderate and translate or summarize only if needed. However, better to be very clear, Pa. Is that clear? Sorry. So let's then, I will give the floor to Dr. Hamong as the coordinator of the authors. You may start your presentation please, while Prof. Guy will be listening to you and may ask questions later.
Yeah.
The floor is yours, Pak Hamong.
Yeah.
Thank you for Ibu Yanti as a moderator in this webinar. Good afternoon, ladies and gentlemen. I'm glad to see you all. Let me introduce myself and my team. My name is Dr. Veteriner Hamong Suarsono from Department of Biochemistry, Veterinary Faculty of Udayana University in Bali. And my team.
Good afternoon. My name is Dr. Kedokteran Hewan Universitas. I work
Bisa sebenarnya. Nanti ditranslate sama yang di itu
Thank you. Thank you all. My name is Masa Tenaya. I'm a head of Veterinary Disease Investigation Center in Denpasar, Bali. Thank you.
Those and another team members that I cannot mention one by one. Especially for distinguished guests, first, Prof. Guy Daly, the beauty of Vice Chancellor Education and Student, Coventry University, UK, and second, Prof. Ali Gufron Mukti, Head of Research and Innovation Consortium for COVID-19, Ministry of Research and Technology, National Agency of Research and Innovation. Third, Mr. Panji Muhammad Panji Pujasakti, from Minister of Research and Technology, National Agency of Research and Innovation. In this lovely afternoon, I would like to thank for the opportunity given to me to present for my article, Preliminary Study Case report of Corona-19 was firstly reported in pandemic situation. Background, as introduction,
nggak mau dapat nih. Soalnya
the novel coronavirus 2019, known as COVID-19, firstly reported in Wuhan, China, December 31, 2019.
Are you using the PowerPoint? Do you want to share your screen?
nah, nggak bisa di-share masalahnya.
If not, we can look at the PowerPoint ourselves.
Iya, soalnya guesnya nih, tolong beritahu. What is disable?
Yeah, disable maksud screen.
Nggak bisa deh.
Iya, makanya tolong sampaikan. Karena di kita nggak bisa karena nggak bisa.
Jadi sampaikan, saya harus membaca slide di dalam proyektor ini, maka beliau terpaksa kita tutup.
Nggak gitu Pak. Kita nggak bisa nge-share.
Yang saya dari Prof. Gai. Jadi Prof. Gai mohon dipresentasikan kepada kami, di-share
Share konten, ya.
slide-nya di-share kepada kami. Bu Yanti.
Yeah. Okay. And just to say that Professor Ali Gufron Mukti has now joined us. Good morning.
Atau saya pakai ini deh.
Enggak, mintanya Prof. Deli itu coba di-share ke Zoom.
Guy,
Gitu
sorry.
Hello, Yanti.
Yeah. Yes, Guy, sorry, because you are supposed to be the host.
Yes.
Actually, do you remember the slide I shared you about 2 days ago? The slide.
Yes.
If you can share to the audience, please.
Okay, I share my screen, yeah?
Yes.
Yes.
Yeah.
Okay,
Yeah.
sorry. And just to say,
Okay.
Miss Yanti,
Yes.
Miss Yanti,
Yes.
Miss Yanti, if you can tell people that Prof. Gufron has now joined us as well.
Iya, thank you.
Sorry, Pak Harara hadirin yang mendengarkan, Prof. Ali Gufron Mukti sudah bersama kita. Selamat siang, Prof. Good afternoon, Prof.
Selamat siang, Bu Yanti.
Ya, apa kabar, Prof?
Nice
to meet you, Prof.
to meet you, Prof. Gai Dali.
Hi.
Yeah.
Yes, thank you. Kan?
Yeah, okay.
Okay. Shall we start the presentation again then from slide 1?
Yeah, that's okay. Yeah, Pak Hamon, you may go on.
Okay. Next, preliminary study is report coronavirus disease 2019 or COVID-19 and pets in pandemic situation is study of 15 patients. Next. Background as introduction, novel coronavirus 2019, known as COVID-19, firstly reported in Wuhan, China, December 31, 2019. WHO reported on February 17, 2020, COVID-19 has spread globally, affecting 25 other countries in the world.
Back.
Human, recently the virus.
Sorry. That's right.
Besides infect human recently, virus also infect, although the data is still limited. It's evident, or this is limited data, there are 2 dogs and 2 cats in Hong Kong were tested positive for SARS-CoV in March 22, 2020. The other place in Belgium reported that cat tested positive for SARS-CoV-2, and 1 week after the owner was diagnosed with COVID-19. It was considered important to investigate pets that close contact with COVID-19 positive owners. Next.
Next slide.
Yes. Next.
Okay. Sorry. Great. Is that the right slide? Am I on the right place?
Okay. Yes. Yes.
Okay.
According case report shown by the table, they pointed patient, age, sex, occupation, house interaction, contact history with COVID-19 patient, and visited pandemic area, in-house interaction, the existence of animal pet like dog or cats. We can see for the table, there is the highest data for the according to the occupation, housewife is highest, and then the smallest shopkeeper, farmer, and teacher. Next slide. This is characteristics of, based on occupation and based on history contact with COVID-19. Mostly had historic contact with COVID-19, numeric or namely 60.00%, and the smallest had visit pandemic area just 13.33%. Based on proportional impact, cat is the highest or the mostly the numeric, namely 60%, cat, and the smallest dog 13.33%. Next. If we show or now about this tablet above, we can discussion and conclusion. The current published data suggested that both human and their pets that close contact to each other got positive COVID-19. This is similar condition have also been observed in Wanaya Hospital in Denpasar, Bali. The data case report associated with human cases COVID-19 in Bali were conducted, but the investigation pets in not being testing those animals with PCR using COVID primer. This information will be crucially important in speaking collaborative transdisciplinary One Health approach to help prevent future COVID-19 outbreak.
Okay, sorry, that side, yeah. Okay.
This is the end of my presentation. Furthermore, we ask guests or editor in discussion to provide input and vision. Thank you for your kind attention. Good afternoon.
Okay, Hamong, okay, shall I summarize or not in Bahasa or not for the audience? No need, yeah?
Excuse me, Ibu Yanti, may I conclude a little bit what was mentioned by Dr. Hamong?
Yes, please.
Okay, thank you, Dr. Gai. Good afternoon, ladies and gentlemen. Although Dr. Hamong had mentioned the presentation, I would like to summarize a little bit what has been done so far. It is actually a good result at the moment. In human cases in Bali, we have 15 human cases. 12 of them had pet, including cat and dogs. However, those pet animal we don't test yet associated with infection COVID-19 from the human cases. Therefore, this is a novel study in future we would like to do in our lab. In summary, human cases, those human cases, 15 human cases have been done and have been tested using PCR, and those animal cases not yet tested. Therefore, also we would like to do his research in the near future, and by doing that, we will get a more comprehensive data in associated with publication and etc. Thank you very much.
Okay, back to me. Yes. Can you hear me?
Yes.
Okay. Do I need to summarize in English or shall I leave it to Prof. Guy? Do I need to summarize in Bahasa? I mean, sorry. No need?
Maybe you don't need.
No need, yeah?
Quite clear.
Quite clear. Okay, for the audience. Okay, then Guy, the floor is yours. You remember last time when they gave the paper through me to you, you have a few questions to clarify with the authors. So about what does this table refer to? Are they talking about the same? So maybe because the authors are there, if you have any questions relating to the paper, that would be very grateful. Thank you, Guy.
Bukan saya, Pak, dimatiin sendiri kan?
Could you please, Ibu Yanti, to turn on mute? Speaker.
Speakernya siapa?
We couldn't listen it yet.
Okay. Guy, we couldn't listen.
Sorry. Okay now?
Okay.
Yes.
Thank you. Yanti, I need to find the version of the paper that has my comments on because the version that was sent around, the most recent one, I'm not sure of it. Does it still
1st of June. 1st of June. 1st of June.
And does the version that was sent round, does that still have the comments on?
Yeah, yes, that's the clean version, but the one you have your comments, the dated the 1st of June. I sent you 1st of June.
Okay, let me have a look, please. Sorry. Maybe when I'm looking, we can invite Prof. Ali Gufron to address the meeting, to say hello, and also some introductory comments as well, whilst I find the paper.
Yeah, 1st of June, Guy.
Okay, Prof. Gufron.
Thank you very much, Prof. Gadai. Long time did not see you physically. So, yeah, congratulations also here. I saw Prof. Ayam. He is the OBGYN from University of Indonesia who joined this meeting, and also Pak Hamong and etc. I think this case study actually interesting because it is new, relatively new globally, but of course 15 cases is really not quite huge, but I think it is something. So if we can have in-depth interview, then this will have more meaningful. And of course that actually from the data that those patients mostly having history of contact with the patients. So this is the most important factors, and also some visited pandemic area. But then for the pets, it is still need to more clarifications, because not all the patients, they have pets. So I think we need more clarification and in-depth interview how the relationship between pets and the owners or the patients, because I think, of course, there are many journals talking about the pets and the corona patients, which is not quite, transmission. There is no evidence of transmission from pets to the human being. But I think, and because it is only descriptive study, case studies, so maybe Pak Hamong and the friends can have more in-depth interview to enrich the dynamic relationship, how long they have contacted, and what type of symptoms in relation between the patients and also the pets. But clearly that more important here is the contact with the source of transmission, which is the patients. I think that is what I'm going to say, and I think that is all. I think it is for the beginning is good, as the description, especially Indonesia, who now we have many cases and not yet controlled. And now in Indonesia, maybe also if you can give description that the policymakers would like to implement what they call it new normal. So with the new normal, they have to implement very strict health protocols in order to reduce the transmission both from the patient and from pets, if it is any indication from pets. I think that is all. Thank you very much, Prof. Gaidali.
Thank you. Yeah, I think for me it is the problem of the sample size in part, which I think Prof. Gufron is saying. So a case study with 15 patients, methodologically is not very many. If it's a quantitative study, it seems to be a quantitative study. If it was a qualitative study and more of a case study, then one could deal with that, but one needs to go into greater depth, I think. So I think the first question for me is really whether or not the researchers think that this is a quantitative or qualitative study, and if it was a quantitative one, whether or not it is possible to access more patients and greater data. I think then the second thing I would say is that one needs to be clearer probably in terms of what the hypothesis is in terms of any causality. I'm not a medic, I'm not a vet, I'm not a bioscientist, but just thinking, are all pets the same? So the intimacy between a pet and their owner might be different in terms of the different type of animal. So are we comparing the same things? So, but my first question I think is probably the size of the sample. Well, no, the causality, the hypothesis, the size of the sample, and whether or not it should be bigger. Yanti, maybe it might make sense to try and make sure that people are clear with what my question is.
Lebih baik saya terjemahkan sedikit untuk para Pak Hamong dan kawan-kawan. Jadi intisarinya seperti sama dengan Prof. Gufron, akan lebih baik secara metodologi apabila jumlah sampling diperluas dan diperdalam dengan wawancara. Hal kedua yang dari sudut pandang beliau, mohon diingat beliau bukan dokter hewan dan tadi diberitahukan juga bukan seorang dokter, namun harus mungkin hipotesanya adalah hubungan antara sang binatang dengan pemiliknya itu kan berbeda atau sama, dan itu hati-hati dia katakan hipotesanya, Pak. Jadi satu adalah jumlah sampling, dua kedalaman, ketiga hipotesa. Jadi karena kan kalau di antara dua itu kan mungkin hubungan antara pemilik binatang A dengan pemilik binatang B tidak sama, itu Pak maksudnya. Silakan Pak.
Thank you, Ibu Yanti. May I give a comment?
Yes, please.
Yes, thank you. I totally agree what was mentioned by Prof. Ali Gufron and Prof. Gai. At the moment, yes, we only have a limited sample. Therefore, I totally agree with you. In the near future, we would like to get a further sample in associated with sample size. At the moment, we only have 15 samples. In future, we would like to add more. Secondly, clarification. It is true also how relationship between a human or positive COVID and their pet. And therefore, we will make a case definition what does it mean by close contact and so on. And therefore, in the future, we will take more sample and also need a deeper information from patient to clarify the relationship between owners and their pet. I agree with you to add more in order to have a validity of our data. Thank you very much.
Okay.
Jelas ya? Is that clear to you, Guy?
Yeah, yes, it's clear. I think it's clear. But if our colleagues could say, what is the hypothesis what is the research question that you are trying to answer?
Okay. Jadi mohon Pak Among dan kawan-kawan pertanyaan dari Prof. Guy ya, hipotesa kan ini pertanyaan paling kunci karena ini paper ilmiah. Jadi research questionnya apa yang akan dijawab melalui paper ini secara spesifik, Pak?
Okay. Our hypothesis so far is that there is a close relationship between positive human and their pet. As far as the human and their pet, so close contact. It has been published in a number of papers internationally. We got information from that data, and actually in Bali, we are quite fortunate because positive human cases is the lowest in Indonesia. This also make hamper my research at the moment, although we will try as much as we can to get those samples.
Okay. Yeah. So is your hypothesis that the virus can move from the pet to the person, or the person to the pet?
From human to the pet.
From the
because
human.
the base data was originally based on human cases, and
Okay.
we would like to get information from their pet. Whether the pet also get positive or negative, we don't know yet. Yeah, hopefully there is a negative correlation between human cases and their pet.
Yeah.
To make our happy about this.
And how do you know that the human gets the virus before the pet gets the virus?
This is a good question. We don't know yet. Therefore, we start from at the beginning between which one is the first between chicken and their egg. This is a similar question.
Yeah.
Which one is? We will start from a baseline from human to pet, not in vice versa.
Yeah.
Because we don't know it, because it's very much easier to detect in human cases because they report to the medical doctor, and only on contrast the pet don't report to us until we ask them. Thank you very much.
I mean, an idea maybe if you had a very big sample, you could do maybe you could do an association. So, you know, if you had, I don't know, thousands of patients with pets, it might be possible to then say, okay, you know, we have 1,000 patients who have pets, but only, I don't know, you know, a very small number of the pets have the virus. So therefore, there doesn't seem to be any movement from the human to the pet. That might be one way. Another way, I don't know whether or not, what happens if a pet has the virus is the pet treated at all? Does it go to the vet, or not? Because if the chicken and egg situation that you described, which is very good, is one whereby how do we know what the association is between the pet having it and it going to the human, to the person? And if you could possibly have a situation where you had 1,000 pets that have been to the vet that have got the virus, but then you find out that the owner of the pet does or doesn't have it. So that you could, if you've got a big sample, you might be able to do some sort of association type stuff, I'm guessing. What do you think?
Jelas ya Pak Mong? Jelas ya? Paham Mong? Jelas ya Pak ya?
Saya kira nggak jelas Bu Yanti.
Nggak jelas, betul kan?
Iya,
Tidak.
itu harus dijelasin.
Nah, makanya, itu yang paling penting. Terima kasih Prof. Gufron. Jadi begini Pak, kelompok Denpasar, mohon maaf, kelompok Denpasar, Dr. Hamong dan kawan-kawan. Jadi kami jurnal ilmiah tadi Prof. Guy ada 3 poin. Satu, tadi sudah mengerti, saya mohon maaf sudah tahu, yaitu sampling diperpanjang lebih dalam. Nah, ini penting sekali. Jadi untuk membuat kesimpulan, hipotesa apa yang dipakai. Nah, pertanyaan beliau adalah kalau ada ribuan misalnya binatang. Nah, apakah semuanya tertular coronavirus? Berapa persen? Nah, kalau si pet itu sakit dibawa ke dokter hewan, nah itu apa penelitian selanjutnya gitu? Karena dalam membuat hipotesa kemudian mengambil kesimpulan, dan itu penting sekali Pak. Gitu kira-kira maksudnya beliau. Beliau mau yakin sekali.
Mungkin kalau boleh singkat, ini Pak Among, saya nambahi. Jadi kok tiba-tiba tertarik ada hubungan antara pet dan orang itu gimana ceritanya gitu loh. Itu. Jadi apa yang mendasari kok Bapak dan Bapak-bapak yang ada di sini kemudian tertarik tiba-tiba ini apa gara-gara Bapak Ibu semua adalah dokter hewan, terus wah ini bagaimana hubungannya dengan hewan gitu. Jadi itu yang Prof. Geda itu tidak bisa melihat gitu. Hubungan itu gimana, kecuali ada ribuan, terus beberapa terinfeksi dari pemilik atau sebaliknya hewannya menulari pemilik dan lain sebagainya. Nah ini kan nggak ada hubungan sama sekali, nggak apa-apa, sampelnya kecil, kok tiba-tiba Bapak Ibu, Pak Hamong dan kawan-kawan tertarik dan melihat ada hubungan nih. Ternyata tidak terbukti, gitu gimana ceritanya gitu. Itu aja.
This is quite important for Prof. Guy. Ya, silakan. Itu penting untuk Prof. Guy.
Terima kasih atas waktunya. Prof. Ali Gufron yang dulu bicara HIV waktu di Bali kecil. Terima kasih Pak, kita ketemu lagi. Yang mendasari seperti ini. Jadi kita ingin membuktikan bahwa sedemikian akrabnya kenyataan masyarakat yang kita lihat antara pemilik dengan petnya itu sendiri, itu tidak banyak sebagai anggota keluarga yang lain. Nah, di luar ada beberapa laporan kasus yang menduga bahwa itu ada kaitannya. Nah, di sini kita mulai dari 15, 12, 15, kita ingin mencoba dan mengawali, ingin membuktikan apakah keakraban pet dengan pemiliknya itu yang tidak beda dengan anggota keluarga itu juga berperan di dalam memberikan kontribusi. Justru itu nanti apapun jawabannya kita akan memberikan kontribusi dalam kaitannya.
Itu yang kalau kami boleh menyela sedikit, itu yang menarik. Jadi kok bisa katanya di luar ada laporan karena hubungan pet dengan owner itu seperti keluarga gitu ya. Nah itu bagaimana lalu tiba-tiba muncul karena katanya ada laporan dari nggak tahu tadi dari mana, dari luar negeri atau dari jurnal atau apa gitu, atau bukti atau apa gitu. Silakan, itu sebetulnya yang ditunggu gitu.
Ya. Dari jurnal yang dari Hong Kong itu, jadi ibu yang umur 30 tahun itu anjingnya positif dan ternyata yang bersangkutan juga adalah kena COVID. Nah, kami
itu mohon maaf belum clear itu. Jadi menurut laporan dari
Hong Kong, dari Hong Kong, Cina.
Ada itu, ada hubungan antara owner sama pet gitu, atau bagaimana?
Publikasi ya, publikasi. Kita lihat pada
publikasi.
Ya.
Nah itu yang harus diceritain Pak, hubungannya itu bagaimana, terus gimana kok cerita-cerita itu, ini kan yang sudah saya pertanyakan juga sejak awal sebetulnya. Waktu saya komentar pertama kan juga ini, bagaimana hubungannya antara pet, karena yang jelas itu kan historinya yang kontak dengan pasien gitu. Kok tiba-tiba dengan ini pet itu kayak melompat gitu. Ternyata tadi ada basisnya yaitu penelitian di Hong Kong. Nah, itu yang nggak muncul di sini. So, Prof. Gaidai, I think the researchers,
di PPT-nya nggak masuk.
Yeah, they said that because of the report from Hong Kong research, that I don't know the report is, they will report, there is some questions, relationship between pets and the owner, because the relationship between pet and the owner is the same with the other member of the family. So they have close contact, something like that. So, but of course, so the idea is raised because of the evidence from Hong Kong. So this is the most important. The researcher have to show that there is a relationship between pet and the owner. Thank you.
Oh, okay. And what to Prof. Gufron, perhaps if I could ask you to ask the colleagues as well, what do they think about their sample size? Do they think that it could be bigger? What's their methodology?
Ya, ini pertanyaan lagi, mungkin nggak sampelnya ditambah?
Sudah.
Mungkin Pak, ini kan
mungkin ya, sampai kira-kira berapa?
Tambah sedang dengan kondisi.
Ya, so it is possible, Prof. Gaidai, they will increase the sample size.
Okay.
But I do not know up to how many.
Right. Okay.
I think in the statistic at least 30 at least. It depends on the, of course, the power and statistical, and significantly, detection of the power. But 30 is the most minimum.
Yeah.
At least.
Yeah. And maybe there is an element of qualitative case studies type approach as well. So if there were 30, you could do some quantitative analysis, but also maybe a little bit of case study reporting as well of somebody, as to if their pet has the virus and they have the virus, then the nature of the intimacy, the relationship between the two, so you get a bit of a deeper understanding as to what might be going on.
Yeah,
is a suggestion.
Ya, ini Pak Hamom, kalau bisa ada pendekatan, memang kuantitatifnya bisa 30 lebih berapa gitu, atau 40 atau ini. Nah, lalu ada kualitatifnya yang lebih dalam ya, more and deeper, the intimacy, and we can have in-depth interview ya antara owner sama pets. Bagaimana mereka interaksi dan lain sebagainya dibanding mungkin anggota keluarga dan lain sebagainya, ya, atau ada gejala atau apa gitu. Terima kasih.
Terima kasih Bapak. Dari beberapa interview sebelumnya yang kita lakukan, sehingga kami bisa menyampaikan secara singkat tadi bahwa interaksi antara pet dengan pemiliknya dari kasus-kasus yang kami lihat itu sedemikian seperti anggota keluarga lainnya, sehingga dari situ kami tergerak untuk ingin melihat ada nggak kira-kira hubungan pada fakta yang kita lihat itu dengan laporan-laporan terbatas yang seperti kami sampaikan tadi dari Hong Kong salah satunya. Kita ingin membuktikan fenomena itu juga ada di Bali.
need to translate, Guy. Maybe Pak, tolong sebentar, Guy, saying that the based on his what we call initial interview, he finds the a very close relationship between the pet owner and the pet, so like a family member. That is why, that is the driver why they want to dig down further. That is just for your information what we're talking about.
Jadi apa yang saya sampaikan tadi itu pada masuk pada slide kami, itu nggak masuk dalam artikel, tetapi sudah saya sampaikan lewat slide tadi Bu Yanti, terkait ada evidence laporan di Hong Kong ada 2 anjing dan 2 kucing, sedangkan di Belgia juga demikian ada 2 kucing yang dilaporkan dengan pemiliknya sama-sama mempunyai terinfeksi COVID-19. Itu. Yang kedua, kami melihat bahwa animal pet ini adalah jadi semua orang yang ada di dunia ini senang sekali dengan animal pet ini. Yang mana perlakuannya seperti keluarga. Jadi keluarga ya, seperti keluarga. Kalau sudah kucing, bahkan diajak tidur bareng. Nah, ini akan menjadi suatu ketertarikan kami. Seandainya kami nanti melakukan ini terbukti, maka akan sangat berbahaya jika seandainya ada salah satu animal pet ini yang terinfeksi atau positif COVID, ini sudah harus dikarantina. Jangan sampai nanti menjadi ada kasus pandemi yang kedua akibat dari transmisi dari animal pet. Nah, animal pet itu tidak terpisahkan dengan keluarga itu sebenarnya. Jadi bagian dari keluarga ini. Jadi itu yang menjadi tekanan kami atau fokus kami terhadap bagaimana kami selama ini orang agak kurang memperhatikan. Nah, takutnya karena terjadi outbreak yang di tempat itu tidak perlu diperhatikan. Jadi hewannya ini, jangan-jangan ternyata hewannya juga reservoir sebagai pembawa transmitter daripada penyakit tersebut itu.
Okay, so let me actually clarify to Prof. Guy Daly. So, Guy, actually about the report that there in Hong Kong and in Belgium, there is a published report in a journal in Hong Kong that 2 pets, and as you read, are infected with COVID-19, and also in Belgium. So, because mostly they are vets, they see a close interaction between owners and the pets, as if and as they are members of their family. That is why, that is the driver. If they can prove that there is a co-relationship between the two, then it could lead to another outbreak of pandemic. Actually, that is the main driver. That is to say, if they can prove through further research and there is a collaboration, then the pet also should be the focus of what we call to be careful about. That is what he's saying, Guy.
Yeah. Okay. Okay. And in terms of those journal articles that have been published so far, how big was the sample size? Do you know?
Hello, Dominic.
Hello.
The title of the published paper is Forensic Science International Report.
Okay.
The title is also COVID-19 and Pet When Pandemic Meet Panic, something like that. In this paper, it is mentioned that so far, despite of more than 1 million people around the world having tested positive for the virus, only 4 cases have been reported in which pet have apparently tested positive for SARS-CoV-2. This have involved 2 dogs and 2 cats. In all 4 cases, the animal owner was sick with COVID-19, and I believe to be the most likely occur transmission the virus to their pet and something and so on and so on, something like that.
Okay. So that paper is the first one in the reference list, yeah?
Yes.
Yeah. Okay. Because I think in some ways also related to the question of where one might publish the paper, then maybe one would go back to this journal that has already published some papers. And if the sample size from your paper of either the pet owners or of the pets is as large as in this original paper, then that might be in a good position in order to be able to get it published. I'm just looking at the paper and I'm just trying to see the number of sampling. Yes, sampling, either the pets or the owners. It looks to me like it's very much a very, very small sample and more of a case study, really.
Yeah, case study.
And maybe that's, so back to the big question that we were saying earlier, like Prof. Gufron was saying, if you could get up to a sample of 30 people, then that makes it a stronger quantitative study. But at the same time, if you go deeper and you do case studies and interview and all that sort of stuff and explore the circumstances of each case, you could have a more qualitative study. So, yeah, that's probably what I'd say.
Yes.
So I apologize that I am just repeating myself, going around in circles, but I think the questions are the hypothesis and the methodology. That needs to be become clearer, I think, to the reader for sure.
Ya, mungkin saya bisa jelaskan supaya sangat jelas karena nanti untuk para pembaca tentu untuk bisa terbit di sebagai jurnal ilmiah, mungkin tadi rujukan yang dari Hong Kong itu juga menjadi dasar dan tadi beliau Prof. Guy sangat menekankan pada jumlah sampling. Jadi beliau mohon maaf mengatakan berkali-kali jadi hipotesa mana yang dipakai, metodologi dan kedalaman setiap case study itu dieksplorasi dengan lebih mendalam sehingga kira kesimpulannya juga nanti lebih akurat gitu, Pak.
Okay, so I think maybe some further work on the hypothesis, the methodology, and the sample size would be good, and then maybe we a further drafting of the paper, and then we could maybe reconvene again. Is a suggestion.
Jadi ini bagus sekali, tuh beliau baik sekali Pak. Jadi kalau saran dari beliau, tolong perhatikan hipotesa, sampling, metodologi, tadi Prof. Gufron katakan, terus tadi rujukan tadi yang pertama, kemudian mohon di redraft paper kedua, terus kemudian kita jadwalkan lagi webinar lagi, begitu. Karena ada satu faktor penting, satu lagi baru bahasa, tetapi yang lebih penting adalah substansi baru bahasa, kan begitu. Setuju Pak Mo? Prof. Gufron?
Setuju sekali. Jadi kami sangat terima kasih yang sangat mendalam. Jadi ini adalah salah satu beberapa masukan dan guiding untuk next. Bahkan kami sekarang sudah menyiapkan lagi Prof. Gufron untuk kurang lebih 60 sampel. Jadi di SPD 60 sampel, Prof.
Wah, itu lebih bagus tuh.
Iya, 60 sampel. Jadi kemarin kami diminta.
Yang penting nanti in-depth-nya Pak, di in-depth interview kaitannya dengan PET itu.
Iya.
Estimasinya, ya.
Iya, Prof. Jadi sekali lagi rumah sakit pendidikan yang ada di Udayana itu sekarang sentral pasien yang positif COVID, Prof. Jadi kami besok akan melakukan kelanjutannya dari time series ini ke rumah sakit SPTN. Itu yang ada kurang lebih 90. Jadi mungkin yang punya binatang itu 60, Prof, yang animal pet. Itu yang akan kami tindak lanjuti. Nah, kami sekarang lagi melihat regulasinya, Prof. Karena aturan ini jangan sampai nanti akan menabrak seperti itu. Karena kita sudah masuk kepada animal pet. Nah, apakah nanti secara aturan kita ngambil swab-nya dari animal pet ini bisa diperiksa di dinkes bagaimana? Kami lagi konsul itu, Bro. Untuk
itu lebih bagus lagi kalau ada pemeriksaan dari petnya. Nanti
kami lakukan itu, Bro. Kami akan melakukan swab daripada hewan itu, karena ini kan hanya tidak positif, tetapi secara laboratorium risetnya ini belum kita ambil swab itu, Bro. Ini kami nanti konsultasi dengan dinkes, Bro. Apakah kita bisa memeriksakan swab ini dari animal pet ini ke dinkes atau nanti kita langsung ke SPTN ya? Karena kebetulan di SPTN tersebut mempunyai perangkat untuk PCR test itu, Bro.
Ya, kalau yang positif ini basisnya PCR test ya. Itu kan Pak Budi dari BPPT ini di tulisan itu menanyakan tuh. Dari PCR test.
PCR test.
Yeah, may I, sorry, actually translate for Guy, please. May I? Sorry, Guy. They were talking about Dr. Hamong, actually. So he has now, in his case, 61. Actually, to be explored further. At Udayana, Bali, there are 60 cases, so about 60 have pets, actually. Now, he is exploring about the regulation, about the swab test, actually, so using PCR.
And also trying to test the swab from the pets.
Yes. It is clear to you, Gaya? So. Yeah. Is that clear to you, Guy?
I think so. Yes. Yeah. So having a larger sample size, I think, would be good. And then thinking about the focus in terms of back to the colleagues who were talking about the chicken and the egg, whether or not we are testing whether or not it goes from the chicken to the egg or the egg to the chicken. And it may be both, but it's yeah, it depends. Again, it depends on which research audience one is focusing on, because I think most people would be more interested in whether or not it moves from the pet to the human, public health-wise. That's probably very important. If you are a veterinary scientist or more interested in animal welfare, you might be more interested in whether or not it goes from the human to the pet.
Tolong, ini penting sekali. Mohon maaf kepada para penulis di Denpasar. Satu lagi, tolong diingat selain 4 tadi adalah tadi chicken and egg, yang mana kausalitas di antara kedua, dan kemudian juga perlu tolong diperhatikan siapa target pembacanya. Apakah para ahli epidemiologi, maka dalam hal itu mereka mungkin akan lebih mau tahu, misalkan apakah dari manusia bisa ditularkan, dibuktikan bisa menularkan langsung kepada hewan peliharanya. Tetapi kalau misalkan target pembacanya lain, mungkin angle-nya lain. Itu yang satu pesan dari beliau.
Oke.
Jelas?
Mohon diulang, Bu Yani.
Jadi begini, tadi Prof. Guy, bisa mendengar Pak?
Ya, bisa.
Ya, Prof. Guy menambahkan satu sudut lagi di samping hipotesa, metodologi, jumlah sampling. Kemudian satu lagi adalah hubungan kausalitas chicken and egg. yang ke sini yang ke sana atau sana yang ke sini. Ini kan harus jelas betul. Kemudian kalau menjadi paper, mohon tolong diperhatikan target pembacanya kira-kira siapa. Apakah satu dokter hewan atau misalkan ahli FKM atau ahli epidemiologi. Artinya mereka akan lebih tertarik kalau bisa dibuktikan bahwa manusia menularkan kepada binatang yang dianggap seperti keluarganya. Kalau itu targetnya para dokter hewan, mungkin kebalik, kira-kira begitu, Pak. Tolong dipikirkan itu. Nanti untuk terakhirnya.
Baik, Ibu Yanti. Ini namanya case report. Kita mencoba mengklarifikasikan apa data yang kita punya sekarang. Sebenarnya untuk membuktikan apakah virus corona ini bisa menulari hewan, dan sebaliknya itu further research harus dilakukan itu. Misalnya begini, kita cari isolat dari human cases, kemudian diinfeksikan ke hewan percobaan, apakah itu anjing atau kucing, itu kita tes dengan PCR. Apakah dia menunjukkan gejala klinis atau tidak untuk membuktikan dia sebagai carrier animal. Kemudian berapa lama dia bertahan, kan itu riset. Artinya penelitian yang betul-betul desain dari awal. Nah, karena ini adalah case report, gitu ya. Sebenarnya case report itu tadi sudah disempurnakan oleh Prof juga oleh Pak Gaeta itu untuk menambahkan N sampel. Jadi kuantitas dan kualitas itu kami sepakati untuk ditambah supaya lebih representatif seperti itu. Mengenai pembaca, itu namanya dipublish internationally, itu mungkin pembacanya bisa kita menampilkan data saja sesuai dengan alur bahwa dari manusia ke hewan. Peranan hewan ini kalau positif tapi tidak sakit, itu minimal membuktikan bahwa hewan ini karier. Itu tidak menunjukkan sakit gitu. Nah, ini karena seolah sudah ada publikasi, tentu saja virus corona ini bisa menginfeksi hewan, tapi sejauh mana, selama mana hidup di hewan itu juga kita akan dikejar. Terima kasih, Ibu.
Yeah, sorry guys, just to clarify, because this is a case report, so they are actually clarifying their initial quote-unquote finding. Of course, a further research needs to be undertaken if we are going to explore and prove the causality of the chicken and egg and everything is, as you suggested. As to the reader, actually, what they have in mind is to present the data as it is.
Okay, so does that mean, Ms. Yanti, that the intention is to develop the paper as is with the current sample size?
Jadi ya, Pak Hamong dan kawan-kawan, jadi pertanyaan penulis, jadi masuk yang 15 paper ini, yang 15 kasus dengan 15 yang telah dilakukan ini, apa yang tujuannya, Pak?
Saya dulu sebentar, Fakultas Udayana. Jadi ini sebenarnya ada dua kesimpulan yang sama-sama bagus. Seandainya nanti memang ternyata positif dan dia bisa transmisi dari manusia atau ke animal pet, tentunya ini adalah sebuah informasi penting kepada masyarakat global yang kebetulan sayang sama animal pet. Ini juga harus hati-hati jika salah satu dari keluarga antara animal pet dengan si owner, kalau satu ada yang kena ciri harus benar-benar isolasi atau di karantina. Itu yang pertama. Seandainya toh pun negatif, ternyata jika tidak terjadi transmisi antara animal pet ke owner atau ke human, maka kita aman. Jadi betul-betul boleh, walaupun misalnya si human ini positif corona, juga akan boleh bisa bergaul dengan animal pet. Jadi jawaban ini sama-sama bagus sehingga masyarakat global tidak perlu takut lagi kalau ternyata dari hasil case report ini atau penelitian yang kita perdalam nanti akan jawaban itu yang jadi kalau juga bagus, negatif juga bagus karena ini novel ini kan bagian dari kebutuhan kepada masyarakat global yang memang sayang sama animal itu. Ini ada tambahan dari Dr. Suryana sedikit Ibu. Saya terima kasih banyak masukannya bagus sekali dari Turki, dari Prof. Mohon maaf kami agak telat sedikit mengirimkan kembali revisi dengan saran Prof. Judulnya sekarang itu adalah preliminary tadi sebagai studi awal. Nah tentu dari studi awal dan fakta itu akan kami lakukan dengan penelitian. Nah tentunya nanti dalam penelitian itu kami akan masukkan, cantumkan jumlah sampel, hipotesis, metodologi dan lain-lain. Nah mudah-mudahan harapan kami dengan fakta yang sudah ada, kami bisa memenuhi target sampel minimal karena dalam tanda petik kondisinya masih progres. Jadi ini awal kami kumpulkan 15, ketemu 12 punya gap. Dan berikutnya, disampaikan rekan saya tadi Pak Amo itu, sebetulnya ada kasus-kasus lain yang bisa kita kumpulkan lagi, sehingga minimal memenuhi target sesuai dengan statistik, sehingga nanti hasilnya itu akan bisa dikawal statistik. Barangkali itu Prof masukan dari Prof yang sangat luar biasa, kami sangat berterima kasih.
Nah, maaf Prof Denpasar, tadi pertanyaan paling dasar yang sekarang 15 ini apa tujuannya? Jadi belum diapa-apakan, jadi masih direvisi lagi dong, begitu kan? Bukan hasil akhir dong, bukan kan? Bukan ya?
Belum.
Enggak. So Guy, back to they are very appreciative of all your input. So bear in mind, as was said in the very beginning, it is a preliminary study. So they have taken account actually what you and Prof. Gufron particularly have suggested, but their initial intention is if further research can prove either positive or negative, both are equally important, then it will help inform the global community, particularly those who have pets of the danger, if not of not the danger. But as it stands now, this needs what we call, this is just a paper which they need to undertake a further research and so as they said in the very beginning.
Okay, so
okay.
I think so. So the idea is to continue to develop to develop this paper without extra data as a preliminary study.
Yeah.
Okay. In which case, I'm very happy to help in any way I can to develop this paper. That's okay, and I can ask some other colleagues in Coventry who are the scientists as opposed to me, who is a social scientist.
Oke, tuh Pak Among baik sekali ya. Tuh katanya jadi mohon tadi itu diperbaiki, diperdalam, diperbanyak sampling. Beliau dengan kebaikan hatinya bersedia, atau seperti saya katakan kemarin di Gladi Resik, meminta kolega beliau yang saintis di bidang sosial untuk membantu Bapak juga supaya keren gitu loh kira-kira. Tetapi mulai dari beliau dulu. Begitu Pak Among, jelas ya Pak Among? Senang kan? Nah, senang kan? Okay. So may I, before I conclude, let me conclude, then maybe I will ask either the audience to ask just one question to Prof. Guy Daly about COVID-19 maybe in the UK. Let me clarify for the writers, please. So what you need to undertake, if I'm right, please look again at your methodology, your sampling, your hypothesis, the chicken and egg factor, that is very important. And also to include with more clarity, please, the Hong Kong report. And then we will take it from there, and also to look into about the regulation about the swipe, and then rewrite the paper, which is going to be, I imagine, going to be deeper. At that stage, give it again to me for initial editing. I'm also not at all, by all means, an expert at all. Give it to Prof. Guy. He or one of his colleagues will help you polish a little bit. Is that clear?
Yeah.
Jelas ya? Jelas ya, Pak Among ya? Okay, now, yeah, okay, before we still have 10 minutes, if any of the audience would like to ask a question, or if Prof, any of your Prof. Guy Daly would like to ask a question to Prof. Guy Daly about COVID-19, not about pet please. He is not a vet surgeon in the UK. Why? Because at UNJ, he talked about COVID-19 in the UK. He is the what we call advisor of the NHS, BPJS Inggris. Beliau salah satu dewan penasihatnya. Monggo, silakan. Kalau ada yang mau tanya. Atau Profesor kali bertanya atau salah satu.
Mungkin ke beliau Prof. Gufron. Jadi ini adalah merupakan titik awal untuk mencari misteri daripada peran daripada animal packing sebenarnya. Kami belum melakukan eksperimen secara substansial tentang sampai mengambil swab segala macam, tidak akan kita ujikan secara tes PCR. Nah ini yang akan menjawab sesuai dengan action kami, roadmap kami, bahwa ini merupakan preliminary case report. Tentunya ini akan terus berjalan sesuai dengan roadmap dari penelitian itu. Nah seperti itu. Nah tentunya kami dari tim kecil ini yang hanya punya niat yang baik untuk negeri dan bangsa ini, barangkali mohon fasilitasi jika terjadi misalnya kendala-kendala yang berkaitan dengan aturan. Karena kita tiba-tiba ini kita melibatkan animal pack, ya. Nah ini tentunya jangan sampai nanti kita mau memeriksakan swabnya kami mengalami kendala-kendala, seperti itu. Karena ini menurut kami adalah sesuatu yang krusial, ya. Dan sejauh ini yang kami baca tulisan baik yang itu dari jurnal hanya fokusnya di human to human, bukan dari human to animal. Nah ini, jadi mudah-mudahan ide dari kami tim ini, yang tim kecil ini sementara diberikan semacam panduan atau dorongan untuk memberikan semacam kawal supaya nanti kami tidak mengalami kendala-kendala yang sebenarnya tidak. Nah seperti itu, Prof. Nah sebenarnya kami sudah disiapkan dengan beberapa sampel yang saya sudah sampaikan ke Prof. Gufron tadi, kurang lebih ada 60 yang sudah mempunyai animal packing. Kalau yang tidak mempunyai, yang sampai keseluruhan 90, Prof. Jadi yang kami sekarang ini, besok ini kalau sudah nanti dengan adanya burung webinar ini, tentunya kami lebih bersemangat, itu kira-kira. Terus yang kedua, barangkali nanti ini dijadikan juga las daripada DM daripada tujuan kami untuk tulis jurnal ini berindeks Scopus. Nah itu kira-kira yang penting, Prof. Itu katanya Bu Lili bisa ditunggu-tunggu sama Bu Lili jadikan segini. Jadi kebetulan ya seperti itu. Nah ini Bu Yadi, jadi sebenarnya akhir daripada ini kita bisa menulis supaya nanti diakui pada jurnal yang terindeks Scopus itu, Bu Yadi. Terima kasih.
Okay, so Prof. before we conclude, because Guy, I think, has got another meeting in 10 minutes. So Guy, what Prof. Among was saying just now is that as he said, this is just a start of a beginning to explore the mystery. So further research and further investigation need to be undertaken, including PCR testing and so on. So he was asking for Prof. Gufron's help, actually, as to about regulations, because they need to test the pet, because otherwise they cannot do their job. So at the end of the day, at the end of the day, actually the last goal will be, of course, to publish this in an international journal, Scopus, as you know. But this is actually, it starts with, from the bottom of the heart of pure and good intention, actually, because most are vet. One is, as you know, is an internist.
Yeah. Okay. Okay. So the way forward is maybe to continue to develop the paper and have another conversation, another meeting, or email conversation to develop it, I think.
Yeah. Yes. Yeah. When will you come to Indonesia, Prof. Daily? So,
yeah, I would like to be very soon, but I'm not allowed to go to Scotland or Wales at the moment. So
ya, jadi jelas untuk para penulis di Denpasar. Jadi langkah selanjutnya mohon direvisi papernya. Kemudian kita, seperti saya katakan kemarin, bisa berkorespondensi melalui email atau jadwalkan lagi webinar. Kapan beliau datang? Ya, beliau juga mau datang, tetapi beliau tidak dibolehkan oleh negaranya. Begitu. Ke Skotlandia aja nggak boleh, mau ke Indonesia lagi. Dalam waktu dekat. Mudah-mudahan cepat bisa begitu.
Oke.
Oke, ada lagi? Terakhir, sebelum kita tutup.
Saya kira saya mohon arahan dari Prof. Gufron, karena ini kami betul-betul ingin mendapat petunjuk, ya, arahan dari beliau, karena kebetulan beliau adalah ketua konsorsium dari COVID-19 ini, sehingga kami akan fokus, ya, lebih tajam lagi, lebih dalam lagi dengan dukungan dan arahan dari beliau. Jadi kami sangat senang sekali beliau juga bisa menerima, walaupun waktu itu hanya sekedar kirim-kiriman WA, kemudian ditanggapi serius oleh beliau. Bahkan kami sampaikan kami akan all out, Prof, karena ini akan menjawab pandemi ini masalah bangsa. Seperti itu, Bu Yani. Jadi mohon barangkali dari Prof. Gufron memberikan guiding.
Terima kasih Pak Hamong dan Bapak Ibu sekalian. Jadi kami memberikan dana ya untuk penelitian, tapi baru kita tutup beberapa hari yang lalu. Sebelumnya juga banyak ya. Tadi kami tetapkan untuk di UI, teman-teman untuk Udayana ada tapi tidak terlalu banyak ya. Karena mungkin berikutnya barangkali. Tapi yang jelas seperti Prof. Mahardika, ya saya kira kedokteran hewan juga ya beliau. Atau peternakan, kedokteran hewan. Itu ikut kedokteran hewan ya yang aktif juga untuk masuk di grup kami tentang vaksin. Ya, jadi ataupun yang lain. Jadi intinya adalah bahwa kita dorong penelitian-penelitian dan inovasi itu yang langsung bermanfaat untuk masyarakat. Ini contohnya untuk regen. Jadi pemeriksaan PCR ataupun apapun kita itu tergantung regen atau regensia yang harus import. Nah, kalau bisa meneliti di situ bisa menghasilkan, waduh, langsung kami support gitu. Karena itu langsung bermanfaat gitu. Jadi itu sebagai contoh ya. Contoh lain umpamanya untuk swab stick. Jadi periksa ngambil swab itu bagaimana? Itu sticknya aja import. Nah, kalau bisa bikin ya inovasi bagaimana langsung kami biayai itu. Jadi hal-hal yang beberapa kan sudah ya, dulu test kit kita nggak bisa bikin, sekarang udah, bahkan PCR nggak bisa bikin, sekarang sudah ada yang bikin, baik ITS, ITB, segala macam ya. Jadi ini kalau bisa, umpamanya kita bisa cek ya, apakah hewan ini tuh positif apa tidak kayak gitu, atau bikin tracking dan fencing sistem IT untuk hewan-hewan piaraan yang mereka kalau ada yang positif kemana kita bisa tahu gitu dan lain sebagainya. Saya kira itu. Terima kasih. Sekian. Selamat siang. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much.
Okay. So maybe the very last one from Prof. Guy. What is important for you maybe for Indonesia and because Prof. Gufron is the head of the consortium 19, so his research ministry also has got some funding. So the actually application for funding has just been closed. There is some left for Udayana. UI got the biggest share, but basically the ministry will support any innovation or research that has direct impact to what we call to COVID, like the region, the stick, and so on. So basically, that is the step as it stands today. So any research and innovation which has direct impact, rather than importing from another country, will be supported by the ministry.
Okay. I think I need to have a think, Yanti, about that. I think a big question in the UK at the moment is whether is the social distancing, and whether or not the social distancing needs to be 2 meters or can be 1 meter. And I wonder if this is just a thought, you know, it would be really interesting if Indonesia was able to explore whether or not 1 meter is sufficient, is adequate. To stop the spread as opposed to 2 meters.
Yeah, I think it is interesting question, Prof. Gaidali, to be research. But I think in Indonesian policy for health protocols is 1.5 or 1.5 meters.
Right.
So the physical distancing should be not less than 1.5.
Yeah. So I think sometimes why public health and the government decides on 2 meters is in part, if you say 2 meters, then some people will do 1.5 meters. If you said 1.5 meters, some people will do 1 meter. So it's all the but then there's all sorts of other things happening as well, because if I was with Prof. Gufron in a meeting and we were at 1.5 meters or 1 meters, it depends on all sorts of other things. Are we inside? Are we outside? Is there air circulation? Are we coughing on each other? Are we wearing masks, etc.? So all of those sorts of things I think are important. So for me, that's quite an interesting public health question. Just a thought off the top of my head, but that's something we were grappling with, something we were trying to think about in the UK at the moment. Lots of pressure on our government to move from 2 meters to 1.5 meters or 1.5 meters to 1 meter.
Untuk Prof. Gufron, jadi mohon izin, yang tempat kami ini webinar sebagai tempat untuk investigasi daripada hewan. Jadi Disease Investigation Center Animal. Ya. Jadi barangkali karena kita belum dapat izin dari Kementerian Pertanian, jadi ini masih ditutup. Sebenarnya kami akan melakukan di sini, Prof. Untuk ini kebetulan ini kantornya untuk investigasi hewan seluruh Bali sampai dengan Indonesia Timur sampai NTT. Ini adalah pusatnya ada di sini. Jadi barangkali melalui Prof. Gufron bisa mohon izin ke di Kementerian Pertanian, sehingga ini adalah merupakan hak yang dari Pertanian. Jadi ini kami belum berani melakukan di sini, Prof. Andai kata ini nanti sudah diberikan kami izin, maka selesai dah perjalanan atau enak seperti itu, Prof. Jadi sekali lagi ini masih ada kendala. Kami sedang mengajak expert yang semua ini ngambil swab di hewan animal itu sudah luar biasa, Prof. Cuma ini kendala dengan regulasi, Prof. Jadi siap. Nanti Prof. Gufron secara apa secara informal. Yang ngomong kebetulan ini saya mendapatkan 4
jelas ya.
ada di sini. Ya seperti itu Pak Bu Yanti, sehingga kita terkendala dengan adanya
sedikit mungkin 2 menit. Ini informasi yang sangat baik. Nanti Prof. Ali Gufron dari atas, lainnya kami sudah berdiskusi dengan Direktur Kesehatan Hewan pimpinan kami di Jakarta, diizinkan untuk melakukan animal testing. Artinya untuk mengambil sampel dan mengujinya diizinkan kita di lab veteriner ini. Karena itu adalah ranah daripada dokter hewan atau veteriner. Itu berita baik saya kira. Saya sudah diizinkan, sehingga itu tadi dari atas mungkin Prof nanti yang mengkomunikasi dari bawah kami sudah. Demikian Prof. Terima kasih.
Baik, terima kasih.
Okay, so I think that's all, guys. So they are actually talking about the Indonesian regulation because what they are based now is a veterinary center. Apparently, they have to apply for approval from Ministry of Agriculture. So which apparently they have just today, just now. But they need Prof. Gufron, maybe support for upper level.
Yeah.
So because this is about pet, no, about not human. Okay.
Yeah, absolutely.
Yeah, Prof. Gufron. So I think we can conclude. So is that clear? That Passat, can we stop? Is that clear? Okay. So I think thank you all for everybody who is listening and joining. Thank you to Prof. Gufron. Thank you so much, guys, for your time. I know you are very busy. You are very busy, but you still devote your time to help them. Sincerely appreciated from this end. Okay, thanks Sola. Till next time, don't forget the paper.
Ya,
Okay.
makasih Mas Suryo, Prof. Gaidali, Bu Yanti, and Pak Hamong dan kawan-kawan, and all the audience. Thank you very much. Bye-bye.
Bye. Thank you. Bye. Till next time. Thank you, guys. Bye.
Thank you. Bye.
Thank you. Bye.